Hi, and welcome back to Functional Needs. So, now we're going to have a look at some of the things that can cause a decrease in functional needs. And at the moment, one of the common ones in the elderly, especially, is loneliness in the community. So, the majority of our older people are not severely lonely, but current findings from the social report of 2016 show that 10% of New Zealanders aged 65 to 74 and 13% of those aged over 75 feel lonely all the time, most of the time, or some of the time. So it is quite a significant problem out there. And as our population is getting older, that percentage will more than likely increase. Um, and this is really important, not just because loneliness is painful, which it can be, but because having inadequate social relationships has been shown to be as bad for health as smoking. And it's also been linked to a higher incidence of people getting put into residential care. So it decreases their function because they no longer feel like they're a part of the community, so they stay at home, they don't do things, they become less mobile, their nutrition declines. Um, yeah, it's a mental health issue as well. So, loneliness in the community. Now, this is also on Moodle for you to have a look at. It's in a Word document and it's called Working Together to End Loneliness. So, this is how loneliness is being combated in our communities in New Zealand. Um, and as you can see, there are headings here. There's low cost or no cost solutions, and things like volunteering are really important for some elderly people because it gets them out and it gets them socializing. And there's things like walking groups. And there's also things like all of age concern activities. And we'll have a look at age concern a bit later on. And the other one is agency collaboration. So it's meant to get the agencies together and try and combat the loneliness out there. So, Age Concern talk to, say, the the daycare centres for the elderly, and so they collaborate on how to get people back out into the community. Okay, and over here is how do you reach these people? So, one of the biggest ones is a GP. Traditionally, it's a GP. And also looking at things like getting their hairdresser, okay, involved, or their plumber, or their electrician, or things like that, making them aware of the fact that there is an increase in loneliness out there in the community and getting them on board. And if they think someone is lonely, then they know where to turn to try and get that person help. So now we're going to have another look at Mrs. Brown. And you've now been working with her for 4 months, okay? And you've noticed that she gets excited when you come to visit. This has been increasing over the last 2 months. She increasingly asks you to sit and talk with her or have a cup of tea with her. You have also noticed that over the last 2 weeks, she becomes quite upset and teary when it's time for you to leave. You decide that due to the relationship that you've built with her, that you will talk to her about this. She tells you that most of her friends have passed away and that her family has become increasingly busy with their own lives, and that the only constant person in her life is you as her support worker. So, what you need to do with this information and add it to the bottom of your A3 page, okay, is you need to decide what you will do for Mrs. Brown and how you can help her have more social interaction. You must do this following your agency's policies, such as reporting and other agencies that can be brought in. So you've had a talk with Mrs. Brown. She tells you this information. And so you need to decide who are you going to talk to about this and what agencies do you think could be helpful for Mrs. Brown and why you think they are helpful. That's really important. Don't just put down, oh, I would report to my supervisor that she needs to see age concern. Why are you reporting it to your supervisor? And why do you think she needs to see age concern or that age concern would be beneficial for her? Okay. Now, we're going to have a look at some of the things that can cause a decrease in functional ability and an increase in functional needs. So, multimorbidity. It used to be called comorbidity. It's now called multimorbidity. Includes two or more of the following: a physical, non communicable disease of long duration. Now, this could be CVD or cancer, a mental health condition of long duration, mood disorder or dementia, an infectious disease of long duration, such as HIV or hepatitis C. Now, you can have two of these things from the one category, or you can have two from a different category. It doesn't matter. It's still classed as a multimorbidity. Okay. So it's associated with reduced quality of life because the person can't do the things that they used to do, higher mortality, which means that they're going to die sooner. Polypharmacy. Look at this, all these medications. Now, we're going to have a look at polypharmacy a little bit later on. High treatment burden, which means that they need a lot of treatment for their multimorbidities. We were higher rates of adverse drug events, and that's because of the polypharmacy. They're on so many medications that there's a higher rate that the drug is going to react. Greater greater health services use. So they need to use the health system more than what they usually would. And a greater use of unplanned care, which means going into hospital more often. They lose things like their mobility, so they need to have their care planned for that, and it wasn't planned for. They may no longer be able to drive their car or do their shopping or do housework, things like that. So, multimorbidity is definitely associated with a decrease in function. So there is a management support out there or that can reduce or help these people. And the main aim is improving quality of life. So what you need to do is you need to focus on improving their quality of life. Okay, by taking the person's needs, treatment preferences, and health priorities, whānau lifestyle, and goals. So, if you look at those things, then you will improve their quality of life. It's not what you want them to do or what their doctor wants them to do, but that's up to the doctor. It's about what they need and what their treatment preferences are. Benefits and risks of following a single disease guidelines. Now, out there, there's a disease guidelines, and it's like an algorithm, and you follow these steps in this algorithm, and their treatment plan comes out of that. Now, because there is multi-morbidities, which means that there is two or more, then that algorithm for treatment may not work. So it may need to be modified, or the person may need to have, or should have anyway, an individual treatment plan. Opportunities to reduce the treatment burden, adverse events, and unplanned care. Now, the biggest one here is the medication, the polypharmacy. They need to be able to have a medication review every now and again so that any medication that they no longer need or is not doing any good is taken away, so that they don't have the risk of adverse events with medication. And it also reduces the treatment burden as well because adverse risks with medication definitely increase the treatment burden and increase unplanned care. Improving coordination of services. So it doesn't matter what services they need, by improving the coordination of it and the collaboration on it of it, you're definitely going to improve their quality of life. So just make sure that, or if you can, have a look and see what services are there for that person and make sure that, or, have a look and see if they're coordinating with each other. How the person's health conditions and treatments interact and affect this. So, how does their health condition and treatments affect improving their quality of life? Morbidity prevention. Strategies to reduce incidence of individual conditions that compose common clusters include lifestyle modification, doing things like increasing physical activity, improve their nutrition, stopping smoking, and alcohol moderation. It's all pretty basic, really. Motivational interviewing, which is someone coming in and talking to them and trying to help them to become motivated to do the things above. Referrals to community providers for support, things like a green prescription. Now, a green prescription is not a script for medication, it is a script for lifestyle modification. And it's things like seeing a life coach or going to the gym or going swimming or things like that. It's about lifestyle modification. It's got nothing to do with medication, and you can get them from your doctor or practice nurse. Smoking cessation, as we said above, and this helps treat treat hypertension, which is high blood pressure and high cholesterol. So, doing something as small as giving up smoking can reduce blood pressure and cholesterol. Right, nutrition. Nutrition and functional ability. Now, nutrition, as you know, promotes vitality and an overall sense of health and well-being by providing with the body with energy and nutrients that fuel growth, healing, and all body systems and functions. So you need nutrition to be able to function on all levels. Good nutrition will also help to ward off development of chronic diseases. So, the better the person's diet, the more likely they are to be able to ward off or lay back chronic diseases. That's necessary for tissue formation, cell reparation, hormone and enzyme production. It is absolutely essential for building strong muscles and a healthy immune system. So you need nutrition to be able to live. Okay. There's a saying out there that it's 3 minutes without air, 3 days without water, 3 weeks without food. All right. So you do need food to live. And a good quality diet. Have healthy fats, limited fatty foods, fruits and vegetables, and make sure they're high in fiber. And they also help with a lot of things like better mood, less stress, lower risk of illness, and their cognitive function is also a lot clearer. If you have a good diet, your brain works better. Okay. And physical health, less cardiovascular risk. You have a healthy weight, and you're able to carry out other health behaviours. So, nutrition is really important. And if you don't have a healthy diet, your muscle mass will waste away, which means that your mobility becomes less. Um, you won't be able to function properly. You start suffering from stress, which then leads to things like depression, and it's just a vicious circle. Substance abuse. Now, we're not talking about things like pee and marijuana and things like that. So it's more about alcohol and medications, although illicit drugs does come into it. So if a person is abusing substances, they have more difficulties accessing medical treatment. Okay, so ongoing substance abuse makes it even more difficult to get to the doctor, and it's been found that drug abuse decreases the chance of the patient will follow medical advice, such as taking medication or going to physiotherapy, which decreases their functional ability. So they're not going to follow the medical advice that they're given. And things like alcohol and illegal substances can interact with prescription medications. And we're not just talking about opioids, we're talking about all sorts of medications. So, if a person is on prescription medication and they're also drinking a lot of alcohol, there could be an interaction there. They could increase the effectiveness of the alcohol, or they could increase the effectiveness of the medication. So you just need to be really careful. If someone is abusing substances, they are more likely to have health issues. And I'm not just talking about diseases like cirrhosis of the liver if you drink too much alcohol, it's also things like falls and chances and risks with injury, which will definitely which will definitely decrease their ability to function. Increased social and employment issues. Loneliness could come into it here because they don't want to go out. They're more interested in staying in and drinking and having their whatever it is their substance of choice is, and which means that they then start to get the disuse syndrome, which means that they don't use their legs, their brains, their arms. They don't look after themselves properly, and that it just becomes a big health issue for them. Polypharmacy. Now, we touched on this before. It's been associated with functional decline in older patients. In a study of community dwelling older adults, increased prescription medication use was associated with diminished ability to perform activities of daily living and increased physical functioning, or decreased physical functioning. So, the more medications they're on, the less able they are to function and do the activities that they need. And it's also been shown to increase the risk of falls due to cognitive impairment. And this is seen as both delirium and some forms of dementia, which means that their brain doesn't work properly and they forget that they can't run a marathon anymore, and they go to chase the cat and they fall over. Okay. So, next up, we're going to have a look at some of the things that are out there in the community for the people that you're looking after. So, we'll be back soon.